Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the budget process is underway. The House is poised to pass a $27.3 billion budget that, it looks like a trade-off, education versus public welfare. Dr. Stuart Shapiro is in the House to talk about that, and a couple of the state's leading journalists will be here to discuss other aspects of the legislature's activities. All of that following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, joining me often is the case sitting across from me is one of the healthcare experts we bring in from time to time, Dr. Stuart Shapiro. He's president and CEO of the Pennsylvania Heath Care Association. All right, as I indicated before, as we sit here and talk today, the House Appropriation Committee has voted out along straight party lines a budget that has the amount of money that Governor Corbett would like to see the final budget numbers reached, $27.3 billion, but they did some juggling. Education cuts restored at the expense of public welfare. The guy who knows just about as much about this as anybody we could possibly have, Dr. Shapiro, welcome as always to the program.
Hi, Terry.
All right, let's get into some of the details of this. I thought all along, Doctor, that there had to be a trade-off if they weren't going to increase the budget. The House Republicans look like they're going to stay at $27.3 billion. Welfare, a pretty substantial hit. Explain what you think that means on the public welfare side.
I'm going to step back just a second if I can. As I was driving in this morning to the studio, there was an old Chevy in the parking lot. The kind of Chevy, it must have been a 1955.
The kind that we all learned to drive with?
On. That's
okay,
my point.
I got it.
And it lumbered. Yeah. And remember, it didn't have power steering.
Oh,
and
yes,
we were gradually able to turn it. Well, that's what's happening to the economy today. Yeah. It is gradually turning around. But Governor Corbett really used an expression in his budget address that I think set the right tone. Mm-hmm. He said, government ought to fund must-haves, not nice-to-haves.
Right.
The budget at $27.3 billion, the way the governor structured it, did that. It protected the frail, the sick, the elderly. Didn't leave much room for error, and it did that. The elderly, who I represent and who I care deeply about, need to have the services provided that are provided in the budget. Mm-hmm. And the House budget, which stays at the same kind of level,
$27.3 billion,
protects the mandated services. At least it appears to.
Okay.
And the goal is to make sure that those people can get services when they need them, at hospitals or at nursing homes. But it doesn't mean that there's room for all the non-mandated services. So and as the economy turns around, we want to make sure Medicaid pays efficiently, that it buys services efficiently, and that the elderly get the services that they need.
One of the things that the governor said that I think everybody sort of intuitively favors, and it came out of some audits done by the Auditor General, was that there's fraud, waste, and abuse in the Medicaid program. There may be people getting the services who don't need them. I think some of the audits came out of Philadelphia, but I think it may be true elsewhere as well. What's your sense about whether but the governor said, we're not going to affect those savings, it looks like, through this budget. Do you think you can get a couple of $100 million in savings out of waste, fraud, and abuse in Medicaid?
I think there is definitely fraud and abuse in Medicaid today, and there ought to be zero tolerance for it. Right. What that number is, I can't tell you.
Yeah.
And I wouldn't want to predict. But there's a lot of other things that can be done with the Medicaid program. Again, going back to paying for the must-haves. We shouldn't take people off programs who are on them today who are getting them. But the turnover is high. Set limits that says, unless a service is mandated by the federal government, cut it out. Governor Rendell grew it with
give
good
me a
intention.
couple of examples of that. Do you have some examples?
Oh,
of
I'd give you a lot of examples.
Well, give us a couple. That you think are, at the moment could be.
Does everyone who is getting Meals on Wheels at home really need it, and paid for by the government, or could a family member be providing it? Does everybody need, who is getting housekeeping services, which are non-mandated, non-required federal services, who are having people come into their house and clean their house, paid for by Medicaid, or to provide some babysitting services to the people, which are all nice to have services.
Right.
But the question is, are there family members who are there friends who can provide these services? They are nice to have services. And so what I would suggest, because these services under the former governor doubled. The number of people who got these kind of services in 2002 was about 15,000. Today that number is close to 40,000. And we need to stop some of that.
We're going to run to a break, but before we do so, the other consideration might be if the economy gets better and more people find employment. But I think Medicaid is mostly elderly and kids. Do I got that right?
You do have that right.
You're the expert on that. Am I right about that?
You are right about that. It is primarily the elderly and kids, but there's all sorts of other people who receive services under Medicaid also.
All right, when we come back, there's this whole business of lawsuit abuse reform. It's the linchpin, I think, of trying to accomplish one of Governor Corbett's big agenda items. We'll talk about that, and then coming up, we have our journalists following Dr. Shapiro. We'll get into some other aspects, big things going on, big doings in Harrisburg. As they say, we'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by ReconnectPA.org, supporting a comprehensive transportation funding solution, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hey, welcome back to the program with Dr. Stuart Shapiro. We're talking about this trade-off that seems to be in the offing: education cuts restored, public welfare cuts. The governor has made public welfare one of his priorities. He did not decrease the budget, the public welfare budget. In fact, it may have been a slight increase. We don't get into whether that's true or not, given the use of stimulus money. We won't go there, but we are going to example. Before we get into the lawsuit of abuse reform, there are other examples, I think, that are worth talking about, mentioning. What are some of them? Medicaid, remember, we're looking for
savings in Medicaid.
Right.
We ought to look at the non-mandated kinds of services that we talked about that are nice to have but aren't needed. But we also ought to look at the way payment is made. It ought to be done efficiently. You ought to the government ought to say, what's the quality level we want to pay for, and decide that. And then they ought to pay all providers reasonably close to the same fee. An example would be there may be 3 hospitals or 3 nursing homes in the same relative geography that are getting paid vastly different amounts of money.
How can that be?
Because that's the way the reimbursement system works. There could be 3 nursing homes where you live in Lancaster, and they could get very different amounts of money from Medicaid for the same amount of services. And there ought to be a more efficient way to pay.
And let me interrupt you here. This is, I didn't realize this before. Now, but this won't be reformed as part of the Affordable Health Care Act, right?
Oh, absolutely not.
So it's not part of that. So that has to come under any Medicaid reforms that people
Correct. And government could save and manage their funds a lot better by paying under a uniform payment system. They also
I'm really puzzled by the fact that a lot of this seems so much common sense that if we could save millions and maybe billions nationally, and you're smiling. But,
that's exactly right.
But what I can't comprehend is why can't we make these simple reforms when we're talking about globally changing the entire healthcare system without cleaning up these sorts of problems?
And it's these kinds of problems we ought to clean up. Just like we ought to clean up, there ought to be a uniform assessment across the state for the kinds of services people receive. The system today isn't uniform. And I know that the Governor Corbett is very committed to doing that, but it hasn't taken place yet.
Before I let you go, I want to talk about the progress, something we've talked about, lawsuit abuse reform. The House has passed a bill that, in effect, would change the sort of relationship of who pays what in liability claims. Talk about that and where this is all heading.
The House of Representatives has wisely, and I've got to compliment them, passed two pieces of legislation. One called the Fair Share Act, and they passed it with significant, overwhelming majority. And they also passed something called apology legislation. Both are sitting in the Senate, and both would go a long way towards protecting consumers and at the same time reducing cost of the entire tort system in Pennsylvania.
Now, the apology legislation, I'll let you explain the lawsuit abuse part, is simple. I mean, it's pretty simple. Doctors are fearful of saying, I made a mistake, I'm sorry, I apologize, because they're afraid that will be used against them in court. And so this legislation would finish my sentence.
This legislation goes far beyond that, though, Terry. It really says things go wrong all the time in hospitals or with doctors, nursing homes.
Every part of life.
Yeah, and it's not even a mistake. It's something goes wrong.
Right.
And what people tend to do in the healthcare system is they run, they hide. They don't want to say, I feel badly that this happened, because simple that statement gets used against them in court as an admission that they made a mistake, when there may be, in fact, no mistake. And what we want to do is have a dialogue. People don't sue because they want money. People sue most often because they're mad, and they feel
angry, and the system failed them. They think.
And so if somebody expresses a little bit of sympathy and says, "I feel badly that your mother got out of bed and fell, and her bones were brittle, and she would have fallen at home or in a whether it's a hospital or nursing home."
We have about a minute left. The lawsuit abuse part of it. Go ahead, explain it. The fair share side.
Right now, we have a system in Pennsylvania, and we're one of the few states that does, where somebody who is hardly involved in the situation that led to someone being injured or hurt or that they're being sued about could be held responsible for 100% of the damages.
Right.
And what this does is it's brought lawyers from all over the country into Pennsylvania. Pennsylvania has been rated by the Fair Justice Institute as one of the worst states in America in terms of having fair tort laws.
Right.
They come here, they file copycat lawsuits against manufacturers and others, and they do this because, in the old terms of Willie Sutton, we're coming here because the money is. And the money's in Pennsylvania. We have a lot of good trial lawyers in Pennsylvania who bring legitimate cases, but this state is being inundated by out-of-state predatory lawyers.
All right, great update. All right, coming up, school vouchers, education tax credits, Marcellus Shale, what's going on with all those things? We'll talk about those with a couple of journalists after we pay some bills.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back. Well, we got a couple of the state's leading journalists. They cover the Capitol for their respective newspapers. Amy Worden from the Philly Inquirer and Laura Olson with the Pittsburgh Post-Gazette, frequent commentators, journalists on the program. Gee, Amy Worden, let me start with you. In January and February, we thought all of the legislation the Republicans wanted to pass would be a cakewalk through the legislature. They're 112 to 91 in the House, 30 to 20 in the Senate. One bill passed, But more importantly, the budget and some other important pieces don't seem to be. What's going on up in the Hill?
Right. Well, what looked like smooth sailing when the governor was inaugurated back in January has suddenly, in the last 4 months, sort of disintegrated. You see a lot of division among Republicans, even though they control both chambers. There's no agreement on some of the key pieces of legislation and the key items in the governor's agenda, specifically the budget, Marcellus Shale tax, and vouchers, tuition vouchers.
And I want to come back to those specifically. Do you agree with that? I mean, is there no sense in, I mean, we were all talking about an early budget. I mean, we heard this, well, maybe May. Well, now,
Memorial Day.
yeah, I'm sorry. Yeah, Memorial Day. Well, the House has to pass, I guess, the budget to meet some right-to-know requirement, or what what that's about?
Now we're hoping that the House gets the budget passed by May.
Memorial Day.
Sends it over to the Senate, and then the real fun begins as they start to tussle back and forth. Now, I mean, this morning on Capitol Wire, Pete DeCourcy was saying that Dominic Pileggi says that the House Republican budget plan is the floor of where the Senate wants to talk about negotiations.
Well, let's stay on this for a minute. Here's the deal, Amy. $27.3 billion, the governor said in his budget message. Everybody knows that. The House version, $27.3. They did some adjustments, as I talked about with Shapiro, education cuts, and we can talk a little bit about those in a minute. But it's apparent that the Senate, because we have a $500 million surplus now, who knows how it will grow a little bit, they want to spend some of that. Is that correct?
Right. Yeah, and the projection is that it would be $1 billion, really, by next year.
Next year.
Yeah. And so you have Republicans saying, even suggesting that maybe we should use that money. I think Democrats are screaming it's still a rainy day. Don't put that money away, as Governor Corbett has said, and the House Republicans are saying, do not set that money aside. We need it now.
All right. Well, let's go. Let's start with some of the specifics. Education cuts. Even the House Republicans want to restore some, correct? They want to restore higher ed and basic ed.
The plan they're discussing this week would put about a $200 million chunk or so back into K-12 education. It would make the cuts for the state-related, the Penn State, Pitt, more of a 25% cut compared to the current
and
budget.
About 15% for the state-owned universities?
Exactly. So
I couldn't figure this out. I thought now, if they would have started out with a 25 and a 15% cut, there would have been outrage. Then there's a 50% cut. That's what it was to the state-owned. And now they got them down to where they think, oh, it's still a big cut, but it's not as bad, right? So maybe they're not. Maybe they're relieved that it's not as bad, but it's still pretty substantial.
Yeah. Well, I haven't heard what the colleges are saying at this point, but I know at the basic ed level, there's still a lot of concern, particularly in Philadelphia, where basically the idea is, I mean, the feeling is we're still going to have to make really dramatic cuts. Thousands of jobs will be lost.
All right, we're going to run to a break. When we come back, I've got to ask you about two big things: vouchers and this, where that stands, and the impact fee, Marcellus Shale. Those are two big items we want to cover in the final segment of the program.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Heath Care Association, the future of long-term care.
Hi, welcome back to the program with Amy Worden and Laura Olson, both journalists. All right, let's start with you, Amy. School vouchers, it's having an awful lot of trouble for, that's where, first of all, explain what the voucher plan is. It mostly seems, is percolating around the outlines of it.
Right. Well, the Senate plan, which appears to be endorsed by the governor at this point, would essentially take public money and provide tuition vouchers for low-income students, although that seems to be in a state of flux now as they're discussing perhaps expanding it to some middle-income students, basically to allow them to choose what school they would go to. So they could also choose to go to a private school or religious school. That's the essence of the bill as it's been drafted. It was the top of the campaign agenda for the governor.
Absolutely.
He came in. The Senate dubbed it Senate Bill 1, which gave it a lot of prominence. It looked like it was heading for sure passage, certainly in the Senate.
Yep.
And it has been stalled for weeks now. And now the House, at the same time, has passed a different kind of educational choice, I suppose you could call it, bill, that would provide tax credits for businesses with no voucher attached to it. So basically, you've got
sort of things,
yes.
and the tax improvement credit is already in law. They would just expand it, right, Laura?
Yeah, it's a current program. It's a pretty successful one, and so they wanted to expand it to offer more tax credits, make it more of an incentive for businesses to help some of these students go to a private school.
I want to go to impact fee in a minute with you, but it looks like that they're not on the same page yet. Is that correct?
Right.
Vouchers may get pushed off to the fall. Would that shock you if it did?
No.
Okay. Impact fee, man, governor says no tax. Marcellus Shale, severance tax out. Senator Scarnati and some Republicans say, well, how about an impact fee? Where does that stand?
Well, after months of anticipation, we finally saw the proposal from Senator Scarnati. It's a plan that would levy a $10,000 base fee per well in a municipality, and though the distribution is still in flux, it would dole out money to the local governments, both the municipality and the county where there's drilling, to the conservation districts, and to some kind of statewide infrastructure and environmental projects. And so the governor said none of this can go into the general fund because that would make it a tax.
And it's not in, the House has not taken up any impact fee. You're both right on that. They haven't touched it yet. And Amy, there's going to probably be some trouble over in the House doing an impact fee, correct?
Yeah.
So in other words,
The House has said that the Senate needs to pass it first before they're going to get anywhere near it.
They're not going to deal with it and vote for a tax if they don't get. If they don't have the whole thing in line, is that about?
Political football.
Yeah.
Right? No,
So,
you do it. No, you
go ahead.
do it.
So that puts the Senate really on this tight timeline because they're off next week for the primary election, and so
Oh yeah,
then
we got to
after
take
that,
off for that, even though they're not on the ballot, right? Even though they're not on the ballot, they have to be off.
we got to have our vacations. So.
Yeah.
And so then they come back with about a week left in May to get this out of committee and out of the Senate and over to the House.
Yeah.
So we've got some fun deadlines coming up.
All right, well, great update. I mean, it just seems as we end the show today that we've got a major piece of legislation very much in play, and we all expected. I mean, the general impression was that these would be done much easier than this substantial Republican majority. You both agree with that, right?
One party rule.
Yeah, all right. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, you stay well.